thank you for coming. Now, I also want to introduce our first speaker, Mrs. Peggy Ntswane. She's a social worker. She's been working in the field of addiction for a very long time. Do you think addiction is a problem in the church? It's a problem in families, right? It doesn't have to be drugs. When we think addiction, we think young people. There are many elderly people who are addicted to over-the-counter drugs. And so if we want to have healthy families, and if we want to do evangelism as families, we need to be healthy. How can we be healthy? By preventing things like addictions, by addressing it so that we know exactly what it is about. And should there be people that are addicted, to know exactly what to do. Sister Peggy is also a counselor, and so I welcome her. She's always willing to speak about addiction. It's a topic that she's passionate about. She worked at Elam for many years. She looks really young. She looks really good. But can you believe she's retired? So, Sister Peggy, welcome. Thank you so much for allowing God to use you in such a powerful way every time. And to you, the rest of you, welcome. You will not be disappointed that you have come today. Thank you so much.
First of all, we have to address addictions because it is an equal opportunity disorder, a medical condition, and is classified as a psychiatric disorder. And when I say equal opportunity, I mean it does not choose race, color, religion, age. We all vulnerable to it. And secondly, why I want families to be involved is because we live in addiction. We are South Africans. South Africa is trending. We're #1 drug-using country in the whole of Africa. And we're up there, I think, top 10 alcohol-wise. And of course, other addictions like sugar are making us one of the worst afflicted nations in terms of diabetes and other lifestyle diseases. So we really, as families, as everybody, as individuals, communities, denominations, churches, we have to address this. We cannot wait for the government or somebody else to address it. We all need to be involved. Also, it affects families like any other chronic disease is. Remember, this is a chronic disease. It's progressive, gets bigger all the time, and it could be fatal. It can be fatal. We know cases where it's become fatal. And the health risks that make people susceptible, and these are genetics, one of them. Being a teen, biologically, a human teen, unlike an animal teen, is susceptible. And being youth, and there are medical conditions that also make us prone, like depression, anxiety, bipolar, post-traumatic stress disorder, ADHD. People with these conditions tend sometimes to self-medicate. Once they discover that this substance makes me feel better, it's easier to access, it's cheaper than medication, and so on, it's got lesser side effects, they can use it, they tend to use that to self-medicate. And also because it's accessible, and there is peer pressure in the country. There is peer pressure for everybody, I could say. Another slide, please. Okay. I want to talk briefly about teenagers. Why do I say teenagers are a higher risk group? It's because 90% of all addictions develop during teen years. Very few people say I developed my addiction when I was over 25 years old. Most people will develop this earlier in life, and this is because it's a biological thing. The brain is still growing, and it grows from back to front. The back part of the brain that controls physical ability, emotions, and motivation develops first. And the part that controls reasoning, judgment, making good choices develops later. This is the part that also helps with impulse control. And this development can last up to the age of 25. And for that reason, we regard adolescence now as not ending in 18 years or so, but ending in about 25, 26 years old. And because of that brain development, the brain says to this person, get out, explore, seek, and find. It's a natural thing. It's a natural human thing. And there is poor planning and poor judgment. And at this age, people prefer high excitement activities and low effort activities at the same time. So they become vulnerable to things like gaming, Xbox, PlayStation, and those things. And there's also a sense of belonging and identity that's developing at this time. And you cannot develop a sense of belonging and identity from nowhere, from isolation. You develop that by being with the people you spend time with and the people with whom you have common interests. Who are these people? These are your peers. We don't spend as teenagers most of our time with our parents, but at school, that's where we spend most of our time. And this, therefore, means that as families, we need to do something to prevent our children, our teenagers, from getting addicted from the beginning. How do we do that? We educate ourselves. Sister Connie said something about that. We need to know, address it, talk about it, know about it, and openly acknowledge that our teens are in a very unique situation where they are bombarded by substances all over the place. And we need to spend time with our teenagers. Before I go on to that, we need to understand that this is a reality. We have to use empathy. Put yourself in the foot of your teenager. Understand what they are going through so that you are realistic. And we need to get actively involved in their lives, know their friends, not only their friends, but their friends' families. And their families, habits, activities, and so on. We shouldn't take it for granted that our child will make good choices. Children at this age are very impressionable. We need to talk about substances and use facts. Scare tactics may not work. They may actually yield the opposite result. Talk about facts, how it can affect a person. What are the advantages, the disadvantages, and other advantages if they are there? Just be factual. And also, if there is a family history, there is a genetic predisposition in your family to become addicted, talk about it to your child. Let them know that, listen, in my family, my great-grandmother was an alcoholic. So you've got a chance that you'll become addicted if you use addictive substances. Encourage good values, hobbies, and interests, and teach our kids refusal skills. By refusal skills, I mean basic assertiveness. The ability to say no without feeling guilty. To say it with love, with respect, and not feeling guilty. And we have to keep our eyes open and not just assume that my kid is a good kid, I've got a model kid, everything is fine with my kid. You never know. And remind your kids that you are there for them. Next, please. Now, let's look at the early warning signs of addiction. Once again, don't ignore the early warning signs. Don't make excuses. Don't enable. I'm sure you've heard this word enabling, enabling, enabling. Enabling is something that you don't do it purposely, but you're indirectly allowing the addiction or the use of substances to grow, to continue. Observe everything. Observe your child's eyes, the smells, the moods, if they're changing, social behavior, the friends, if they are changing them. Are they becoming secretive now? Are they evasive? How's their school or work going? Work, because this age group ranges from 13 to 25. So some of them are working already. Some of them can still acquire bad habits. Take their hygiene, their grooming, their interests, their sleep patterns, their eating patterns, and so on. And in general, the whole personality, has it changed? In what way has it changed? And be factual, because you need the facts to address, to confront the changes. And then address things directly. Don't say, have you been drinking? No. Just say, I smell alcohol in you. I can see your eyes are red. So the kid must explain. And also consult when in doubt. Have your resources at hand. You know who to consult, Sister Connie in church, your pastor, your social worker, your psychologist, and so on. Even friends can help sometimes because they've been through the same thing. Family can too. And then you might also need an intervention. An intervention is based on love and care for the individual who are trying to support. It's not a situation where you use emotions like anger and so on. And the nature of addiction. Addiction starts with social use to abuse and then to addiction. Nobody wakes up and says, you know what, I'm going to be an addict, or this is my ambition. It starts gradually. It starts accidentally, I may say. And then it affects your schoolwork, your work, family, your spirituality, your health, your money. Every aspect of your life gets affected, and family roles and balance change. People have to assume a responsibility now that you are not able to take care of your responsibilities. And families may go to shame, guilt, embarrassment, and even denial, try to cover up what's going on because they cannot deal with it. And there's loss of control on the side of the addicted person and unrelenting cravings. There's guilt, anger, and shame after each use. And after each use, there may be some abstinence, and then they start over again. There are denials, excuses, and promises to quit, and this continues on and on, and this can go on for years. It's a vicious cycle, and it can be changed by an intervention once again. What's an intervention? Tips for it is you choose your team carefully. You choose people who really like this person, who love, who care about this person. You plan it. It's not something that you just pounce on a person and say, yeah, we need to talk to you. You have to really plan it, be aware of the time, the place that is most appropriate, and be warm about it, be open about it, and sit the person down, have an appointment with him if you can, and tell them exactly what you are seeing and stick to the facts. The facts usually are very much easier than other things like, using language or abusive language or degrading words and so on. The facts are very easy. You just point out to one, we care about you, we love you, that's why we're having this meeting with you. Secondly, this is what we're observing versus what in the past you were. You were very conscious about work, focused, you were interested, but now you seem not to be interested, you're losing time from work, and so on. The before and after, or the before and current scenarios have to be put to this person, and also offer solutions. Therefore, come to some conclusion. Therefore, we think you need treatment. And then have the resources again. You've already lined up resources. You know that you're going to send them to, if you have medical aid, you know there are so many that can actually take this person at a go. But sometimes they have arguments with you. But when they argue, be prepared. This is not a tug of war. This is where you're just going to stick to your facts and nothing else. And by the way, consequences are also one part, or a very important part of an intervention. Things like, you are going to lose your job if you don't go to rehab. Or you will have to move out of the house because we cannot have our lives changed like this because of your addiction. Okay, classification of drugs. We talk about substances as if they are one thing sometimes and so on. So it's very important to understand that they have different classes depending on how they affect us. We are talking about opiates, about stimulants, about hallucinogens, about depressants. Now, depressants, examples of depressants are things that sedate us. These could be things like pain medication, anxiety medication, sleep medication, as well as alcohol. And stimulants, things like sinus and weight loss medication that contain ephedrine and pseudoephedrine, as well as DIC, CAT, which are illegal. Grandpa also is another stimulant because it contains caffeine. And we have opiates. Opiates all come from the opiate plant. From this plant, we get things like codeine, morphine, pethidine, heroin, and our local nyaope. Hallucinogens are things like drugs, dacha inhalants, and solvents. Solvents, as you know, are things like benzene. Inhalants are also like that, and glue. Some people use glue to get high. And usually, kids will experiment with benzene. Have you noticed sometimes kids who are around a certain age, 13, 14, their school jerseys will be held like this, and they'll be going like this. There would be benzene there. They're inhaling it. This is just to show you the danger of alcohol, what alcohol can do when somebody uses it while they are pregnant. We have fetal alcohol syndrome, which is getting bigger and bigger in South Africa. And in fact, in the Cape, it is said, in the Western Cape rather, it is said 1 out of 280 births have this condition. That's a high number. And if a child with this will never be smart enough to finish school, they may not even go to a regular school because their intellectual functioning will have been damaged before they are born. And as you can see, these are kids from different countries, but the syndrome is the same all over. Once again, it's an equal opportunity disorder. This is all just to show how alcohol can damage your brains. It's not just the alcohol that can damage. Every substance, and every addictive substance can damage the brain. The case here is that the alcohol kills some of the brain cells. Brain cells normally can regrow, but in some cases they don't, and therefore a person is left with a hollow brain, and the brain has shrunk, and therefore even their intellectual functioning has deteriorated. Another damage that is well known is liver disease that can come from alcohol use. But alcohol is not the only thing that can damage your liver. By the way, sugar can. Too much sugar can induce a fatty liver, which is also very dangerous, scarring in the liver and so on. And that is why we really say people should take more sugar, not more than 9 teaspoons per day. And the liver conditions, in the beginning, it can be reversed, but there is a point of no return where the liver is so damaged that you just need a new liver. If you are very wealthy, if you're not, of course, it means a person is going to die. And this is just to show you a picture of a diseased liver as a result of alcohol abuse. In the first slide, you see a normal liver. The middle one, the liver is swollen. It means already it's enlarged. The liver is already suffering. And the last one is the last stages of liver disease. And that is now in the middle. That liver can still be reversed. It can still shrink if a person can abstain from alcohol and have a healthy lifestyle. Something about cannabis, dagga. Dagga has been legalized or semi-legalized in this country, and that can be very confusing to a young mind. If it's legal, then it means it's good. That's what a young mind will say. So we really need to talk about dagga with our kids, and we should start young. We shouldn't wait until they are 13. It can be started around 10, 11 years old, because this is when kids sometimes start these things. For instance, alcohol in South Africa, one of the research has shown that the average age of onset is 10 years old. So we need to talk about this. It's a gateway drug. It's semi-legal. It can be used by adults at home. It's been turned into medications, and that can give people mixed ideas about it and even be tempted to use it. And dagga is so strong on your chest, it's stronger than cigarettes, actually. 1 zol of dagga is an equivalent of 5 cigarettes. So a person who smokes 10 is like smoking 50 cigarettes per day. And it can induce psychosis and schizophrenia for people with a family history of mental illness. I have a family member right now, a bright daughter of ours, who's just been diagnosed schizophrenic due to dagga. She was in show business, very bright kid who had a very bright future. But because of our family history of mental illness and the use of dagga, she's now schizophrenic, and that's it. And it also can cause other things like infertility, and it depletes healthy, feel-good moods. Natural feel-good moods are depleted, and as a result, you need the dagga to feel happy all the time. Now, another thing I want to talk about is opiates. Opiates, as I told you, are from the opium poppy plant. From this plant comes very good medications that we need for pain, especially strong pain. Like when you have a fracture, Panado is not going to help you. You are going to be helped by medication that comes from the opium plant, in other words, by opiates. When you go through an operation to anesthetize you, you might need medication from this plant. However, from this very plant comes things like heroin. And by the way, just to explain a little bit about nyaope, people talk about nyaope, but nobody really understands what it is. It's a nickname that the locals who are using it have coined. This is a mixture of dagga and then with a dash of heroin. So the most psychotic ingredient there is heroin. And then this is a unique situation here in South Africa. Nobody in the world does that. Most people would use the heroin directly or as it is, but in South Africa they mix it with dagga. This is just to show you a picture of what heroin powder looks like. The brown powder looks exactly like brown sugar. Oh, okay. Anyway, this is the opium poppy plant. It's a beautiful plant, as you can see, but from it comes something very dangerous. Now, this plant is not grown anywhere but usually in the Far East, in places like Thailand, Afghanistan, Burma, Turkey, Laos, and then it gets transported to us by drug mules using different devices. One of the things they use when they transport heroin is to stuff it in condoms or in paper foil and swallow these. Sometimes they can swallow up to 90 of them at a time, and then use medication like Nixium to stop gastric acids from developing, so that a person can stay with these until they fly, they reach their destination. Take a person who's flying from Thailand, for instance, to Johannesburg. They've got to have these, and no gastric acid should be secreted to damage the condom. Then, the drug dealer will not have their money and this person will die. And this is one of the most addictive, in fact, the most addictive in the world, and very expensive. And when it's mixed with things like rat poisoning, ARVs, and so on, sawdust, that thing is not just uniquely South African. It's called cutting. You cut. It's done everywhere to dilute it, because if pure heroin is used, the user will not survive for 2 years. They will die. But if this one is used, the diluted one, it's weaker, and they have a chance, I believe, to get treatment, to recover, and to live a normal lifestyle again. So what heroin does, or Nyaope does, it gives exceptional peace beyond understanding. Actually, I'm quoting from one of the things I read, and I believe it. I believe it. People who've been through an operation, surgical operation, where an anesthetic was used that is opiate-based, will vouch for me. Before you pass out, those few seconds, it is so peaceful. It's like you are flying, you are in heaven. And then what it does, it numbs the human needs, or human basic needs for food, for sex, for hunger. They don't feel pain. They don't feel cold. And that is why when they are beaten up after they've done something, the community beats them up, they don't really feel any pain. They will feel the pain if they are beaten before they take the Nyaope. Remember, this is a sedative. This is used by anesthetists to numb you, to sort of make you pass out. So if you beat up a person like this, they don't feel anything. But if they need to be punished, pour them with water. Water makes them extremely cold. They feel sub-zero temperatures when they are poured with water, and it makes them itch. I don't know where the itching comes from, or maybe it's because the personal hygiene has been neglected so much. And then it also causes severe withdrawal symptoms, the hangover is severe, severe, very agonizing pain. They have backaches, they've got stomach cramps, their knees are sores or joints are sores, they have flu-like symptoms, they cannot sleep, they have dry heaves and so on. It's really something terrible to see. So that is why sometimes some of them will have to get another dose to feel better. And it is for that reason again that they need replacement treatment. They cannot be just weaned off without any medication. They need medication. Medications like methadone, like Suboxone. And these medications they can use for as long as it's practical to them, because it takes away cravings and so on. Some people have used it for 10 years and they're functioning. It's better than going back to the nyaope. And then what kills them really is that this suppresses their lungs or their heart and their pulmonary system. And gradually they will die. And when I was working at Elim Clinic, I would ask my clients when I admit them, I would ask them, how many have you seen? How many do you know have died from nyaope using? And none of them ever said, ma'am, I don't know anyone. They all gave me the same answer. They said, we know many who've died. And then I'll test this theory and ask them, just mention their names and count them. And they would go like, it's Peter, it's Bongani, it's Maria, it's so-and-so. And then they would stop somewhere and say, you know what, I'm tired. I can't remember all of them, but the many. And this getting tired of them is because of the damage in the brain. It is said that nyaope or heroin can cause dementia to a point where a 20-year-old's brain will function like an 80-year-old person. So there are memory losses as well. This is the treatment that we give them to detox as well as to maintain the treatment. Now, the problem that people make, or parents, they assume that once you are in treatment, you're in rehab, it's over. It's not over. Rehab is just acute treatment of a condition. And then, because this is a chronic illness, there is long-term working on a person's recovery. So they will need this medication. Families need to invest on this medication. I know our government doesn't give it freely yet. Unlike overseas, wealthier countries like America, England, and so on, they get this for free because they know it's essential for their survival. And by the way, I wanted to know if you'd like to ask questions now or later. We will take questions later. Okay, let's go. Next slide, please. These are just pictures of, you've seen these scenes, they're quite common, they're getting more and more common in our CBDs. This is how a person can deteriorate. This is the same person, but they look so not similar. You don't even think they're relatives. And in just a short time of space, in about 7 years, is how a person looks like. And sometimes it can be even 2 or 3 years, a person can deteriorate. However, there is hope. This person's condition can reverse again, as you can see in the next slide, please. You see from that picture to the after picture, so we know that this recovery is possible. But recovery is something that needs everybody's commitment, the family's support, community, churches, everybody need to be involved with this. Now, the next one is uppers or stimulants. I won't talk a lot about illegal ones like tick and cat, which are also quite common in our communities, and they are called different names. Ice, yaba, crack is also another one. Crack is the cheaper form of cocaine. Um, I'd like to talk more about legal ones on the next slide. The legal ones are sugar, energy drinks, caffeine, grandpa, which is trending, by the way, in South African communities, sinus and weight loss medication that contains ephedrine and, Ritalin, which is medication for ADHD, attention deficit hyperactive disorder. It gets abused by especially students because it helps them focus. Now, these types of drugs make people focus, they induce energy, they prevent fatigue, so you can achieve a lot when you're using them. Older people who are abusing grandpa apparently abuse it because it gives them energy. Students, they use to study and so on. And unlike every other drug, most drugs will have one psychoactive ingredient that causes the addiction, but with grandpa, there are 3 of them. There's aspirin, there's paracetamol, there's caffeine, all of which are addictive. And it also suppresses appetite, and I'm sure you've seen this with children. You give them lots of sweets, what happens? They are all over the place, they're bouncing up and down, they're happy, or that happiness is actually euphoria. And then once the effect is gone, they become cranky. This is why we talk about they crash. They go in a down mood, and a down mood for the strongest drugs, for the stronger ones like DCAT, can lead to suicidal thinking. In fact, they even become suicidal, or they commit suicide. And then legal medications, which we are unfortunately exposed to, and we don't have good controls in our country, and they can become addictive. Just to give you a few examples on the next slide. These are pain medications with codeine. Codeine meds are addictive. Codeine, remember, comes from the same plant where heroin comes from, where nyaope comes from. And examples of codeine-based medications that people are generally abusing, especially women, it's stop pain, alcophylix, Benylin, Adcodol, Miprodol, Tramadol, and so on, the dolls. And then pain medication with caffeine, I've already talked about it. Grandpa is widely abused, usually by older people. And unfortunately, grandpa will raise a person's blood pressure, their heart rate, and it can cause ulcers as well. And then Lennon's drops. Young mothers like to use Lennon's drops for their babies. And this is what they learned maybe from their families and so on. This has got to stop because these Lennon's drops have got alcohol. I've seen one with 6%, another one with 13% alcohol per volume, and I've also seen one with 17% alcohol per volume. So that's not good for the baby. And while this baby is taking the medication, the mother would be bragging about how sweet their baby is, how quiet, how they sleep the whole night, while the baby is actually passed out. Alcophylix also, please, when you have to use any codeine-based medication, use it when it's absolutely necessary. And also check the labels. Everything that we consume now, we have to check what's contained in that bottle of medication. Hubbly Bubbly is another one, very impressive, looks cute, looks hip, and for a teenager who's looking for identity and wants to belong with peers, this can be quite attractive. What happens with it is that this was discovered first in India around the 1600s. It was used by men of prestige, but nowadays it's used by virtually everyone, and it gets abused and it's addictive. And it's very mild, unlike cigarettes that will score your, or, be uncomfortable in your throat. This is very mild. It's like, you're inhaling nothing. But the damage that it does to the lungs is terrible. 1 hour of this is equal to smoking 100 cigarettes. So people have to be really careful, make sure children don't get near this, and in fact, make sure you tell them the facts about Habli Babli. And you see, one of the reasons why it's terrible, it really produces a lot of carbon monoxide in your lungs. And tobacco products. I have to talk about this. I know as Seventh-day Adventists, we really don't use these things, but there are some odd or exceptions here and there where people are using them. All tobacco products come from one plant, that green leafy plant tobacco. And then from it comes things like snave, dry tobacco, BB or Boxer, cigarettes, and cigars. And then the processing is different for each one of them. And of course, of all of them, cigarette smoking is still the most dangerous. And then we always are told about the physical effects, side effects of smoking, but we're never told about the psychological ones. Look at the psychological ones. It induces depression, anxiety, irritability, and stress. People who smoke cigarette cannot tolerate stress. Any small argument or debate makes them so stressed out they want to smoke. They bang doors, and then when they come back after having a cigarette, they are now calm, they're ready to resume. But that ability to cope is so short-lived. They need a cigarette to cope with life in general. And then it can also cause erectile dysfunction and sexuality difficulties with everybody, male and female, and ectopic pregnancies for female, poor vision, premature aging, and bad smell. Cancers we all know about, and heart disease we all know about. These tobacco products can cause it, but cigarettes is number one in as far as the danger of all of them is concerned. Okay, so now we're talking about behavior addictions. These behavior addictions come from normal day-to-day healthy activities, but these activities are addictive. We have gaming, gambling, sex addiction, work, shopping, food, exercise addiction, digital addiction. It's everywhere. It's possible to be addicted to any of these things. And how do we know that we are addicted? If it affects your health, you don't sleep anymore because of it, or it affects your job or your schoolwork, you can't concentrate because of it, you're preoccupied, it causes relationship difficulties with your loved ones, the arguments and so on, or you are an emotionally absent person because of the addiction, or it affects your money, you should know that you have an addiction. Just one of those, you know you've got an addiction and you've got to change. So let's talk first about food addiction. Food addiction, usually people become addicted to food that is really tasty, highly palatable foods. And we also become addicted to food that is sweet, that is fatty, and that is salty. Take people, for instance, who eat fat cakes every morning. Some of these people cannot cope without work. Cannot cope at work without having their fat cakes. They've got to have their fat cakes before they start work. Some of them are breakfasting with cakes or cookies. That's a poor breakfast choice. Fat cakes and cookies, and all of those lead us to diabetes. And comfort foods are usually very addictive. And in general, food that is very tasty releases feel-good hormones the same way as drugs do in our brains. And we get addicted to that feeling. It feels so good, you want to repeat it. And once again, it can also develop tolerance. Whereas a person would eat one chocolate per month, now they need to have it daily or maybe 3 times a day. Shopping can also become addictive because it also can be so fulfilling that feel-good hormones are released and you get used to that, you like it, you want the emotion to be repeated. And this is sometimes a subconscious and unconscious thing that's going on. You don't do it deliberately. You don't say, I want to go shopping to get that feeling. But human beings are easy. Anything that's painful, we avoid. Anything that's pleasurable, we repeat. An example of this, give a baby, or put a baby in front of a candle and then they stick their finger in the candle. Even when they are not developed enough to express how they felt, they will know not to touch the candle or put their finger in the candle for the rest of their lives. That message was ingrained. Now take the same baby, give that baby alcophilics or Lennon's drops with alcohol. The feeling is so good. The memory of how good this was is also ingrained in their brain. So later on, when they come across a similar taste, similar effects, it's like, long time not see, my friend. Addiction started there when they were babies. Gambling can also be addictive. And let's go back to the other slide about shopping. I just want to briefly explain that with shopping addiction, you can tell when a person starts maxing out their credit cards, lies about their shopping, hides their shopping, feels guilty after shopping, that they have a problem. So this too can be treated if you go to a counselor and you talk about it, and then there are certain behaviors that need to be modified. And you can tell during counseling that there are some triggers to it. Maybe the person uses shopping to cope. Shopping is used to cope with loneliness, maybe with sadness, with loss. There's so many emotions that could be hidden that a person is addressing through shopping. Okay, the next one is gambling. Gambling addiction applies to all gambling, even the ones who run Ntswane, I don't know how you call it, but in our townships we have Ntswane. It's usually run, it's a numbers game that somebody has to collect and so on, the money and so on. That also can be addictive, and it's usually done by older women or women who are unemployed or stay home. And there are also card games are becoming rife. People take kids, their children, young children, to play cards until midnight or early hours of the morning. That in itself is a sign of addiction. They are now neglecting their children. Lottery. I know lottery is something that is giving a positive message because some of the money goes to charities and so on, and there is very little money involved, but this too can become addictive. Another one that's very addictive is horse betting in our communities. There are people who really do this religiously, and they are also addicted. And the simple message with gambling is that winners know when to stop. If a person uses it as a social thing, as recreational, they plan it, they budget for it, they do it once in a while for pleasure, I think it's healthy, but if they cross that line, it can become very dangerous. There are many signs to gambling addiction. For instance, things like lying about their gambling, stealing, borrowing, or even pawning things to gamble. And there's also false thinking, erroneous thinking. They feel lucky. They are the most superstitious people, these gamblers. They see a black cat, they don't go to the casino anymore, they're going to lose. They see something, I don't know how they come up with these things and they really believe them. But it's all faulty thinking. That's why in therapy or in counseling, you have to address the thinking behind the gambling. And so the worst erroneous thinking is when they believe that the bigger the bet or the bigger the amount of money you invest in the gambling, the bigger the winning. To me, that's the most ridiculous. And that gets people really caught in financial problems because a person will bet their whole salary thinking they will get 5 or 6 times that much. And then exercise addiction. There is addiction in exercise for some people. As you can see here, the image is there. That one is very disturbing. The person has become emaciated from exercise. It all starts with recreational, social thing, and it's a healthy thing to do. But exercise induces the release of endorphins. Endorphins are also some feel-good hormones. A person feels on top of their world, they think they can cope and so on, and they fall in love with the feeling that they get from exercise. Unknowingly, tolerance also creeps in. They need to exercise more and more and more to get the same effect. And then it becomes now a compulsion. They have to have it. And when they are at the point of addiction, they are now not honoring their family obligations, family lunches and dinners. The only thing that comes first, their preoccupation is gambling, is exercise. And for some people who exercise a lot, their bone density can be lowered, can reduce to, find a 25-year-old with bone density of a 65-year-old. And for women, it can stop their menstruation altogether. Sex addiction is another one that's, it is born from something harmless, something natural and basic human need. But at one point, as you'll see in the next slide, sex addiction can become dangerous. And it is often triggered by emotions like anger, stress, loneliness, fear, shame, unmet needs for approval and validation, low self-esteem, feeling unappreciated, alcohol or drug abuse, sometimes highly stimulating positive experiences like we've seen with people like Tiger Woods. The achievement may have triggered their sex addiction. And then also, it can be triggered by an emotionally and or physically unavailable partner. Now, there are many types of sex addiction, but pornography is one of the most potent ones because with pornography is easy. You download, it's just a human being and their device. It's done at their convenience. There is no negotiating with other parties, so this can really grow rapidly. And then with pornography, we really want people to talk about it with kids because really it is a potent addiction and no human being can compete with pornography. So the scenes that this youngster sees, they think it's the real thing. And another thing about pornography that we have observed is that some people eventually have no ability to engage with other human beings because of it. This is where they get their fulfillment and that's it. Now, that doesn't sit well with human development. At one stage somebody will need a partner, a life partner, and so on. But pornography makes it difficult. and it releases many hormones, many pleasure hormones at once. As you can see, the excitement hormone, feel-good hormone, pleasure, energy, it calms and kills pains. It has love and cuddle hormone, and it induces sleep. So it can be quite a dangerous addiction. Next, please. And digital addiction, this, I think there is someone who's going to talk about it with you, but just to briefly talk about it a little, digital addiction is with us. And once again, it's got no age limits. Even the youngest of us, 2-year-olds, you've seen 2-year-olds, when you take away your cell phone, they throw a very big temper tantrum because they might have become addicted to the images they see on your cell phone. And that is now the end of my speech to you.